Okay, so left anterior hemi block. This is the topic that we're going to discuss in this video. Here is the right bundle branch, here is the left bundle branch, here is the anterior fascicle, here is the posterior fascicle of the left bundle branch. So in left anterior hemi block, the conduction through the anterior fascicle is impaired. So the depolarization of the left ventricle occurs only through the conduction system of the posterior ventricle. Now before I jump onto the ECG finding of the left anterior hemi block, I want to quickly tell you what exactly causes the findings that we're going to discuss about. So, as the depolarization of the left ventricle occurs only through the posterior fascicle and anterior fascicle is basically not working, so the direction of the vector of the ventricular depolarization is directed from the inferior surface of the heart to the superior surface and also from the right side to the left side of the heart. This direction is very important, from the inferior surface to the superior surface and from the right side to the left side. So this particular thing, right to left, causes the left axis deviation, and this inferior surface to superior surface direction leads to negative QRS complex in the inferior leads. So these two things are sufficient to help us guide the diagnosis of the left anterior fascicle in the ECG. So if we take a look at the ECG now, the lead 1, lead 2, lead 3, AVR, AVF, AVL. So we can see that the inferior leads, lead 2, 3 and AVF, have a net negative QRS complex, just as we discussed previously. And also the QRS complex in lead AVF is negative, and QRS complex in lead 1 is positive, and lead 2 it is also negative. So there is left axis deviation.